Stanford Erickson, Editorial Director of Chiropractic Economics, still at Florida here at the show. And I'm with Roger Dumler-White, and he's the CEO and President of Theralase. Tell us about your company, please, sir.
Oh, it's great to be here, and it's wonderful to be at the show. It's nice to see everybody year after year. Theralase is a cold laser manufacturer. We manufacture therapeutic medical lasers. You're taking light energy, you're putting it into tissue non-invasively. There's three main cellular pathways which are used. The ATP pathway, where the body takes simple glucose from the food that we eat, transfers it through phosphorylation, Krebs cycle, and the electron transport chain into ATP, which the body can use. In that process from ADP to ATP, there is a cytochrome called cytochrome C oxidase. That is light sensitive in the 630 to 670 nanometer range, which is red light, peaking at around 660 nanometers. So Theralase uses a 660 nanometer laser. Two other really important cellular pathways are, one, the production of nitric oxide. Nitric oxide is a signaling molecule, very short-lived, causes endothelial cells to relax. So it allows capillaries to open up in size, bring more blood, more oxygen, more fuel molecules, so bringing more energy and blood to an injured area. Also kicks off the lymphatic system, making it more porous, so you allow the absorption of interstitial fluids, removing swelling. Third key cellular pathway is obviously the pain process. The peak absorption of lipids is 905 nanometers. So if you know the cellular membrane, of course, is a bilipid membrane. 905 superpulse technology can make it more porous, allows the reintegration of sodium, the expulsion of potassium, rebalances the sodium-potassium pump, and hence removes the pain signal at source. So those are the three main cellular pathways, which is why Theralase is optimized on the 660 and 905 nanometer wavelength of light.
It's touching all three.
All three pathways. So this technology is optimized for healing tissue, which is why we typically see efficacy rates 85 to 90%. We're one of the originators of the technology. Our technology goes back to Europe, back to the early 1970s. So we've been in it over 30 years.
I understand you're one of the first teachers of this technology.
Yeah, I've been in the technology since 1994. Theralase was incorporated in 1995. A lot of individuals who work for different manufacturers and who actually use the technology. I originally taught them technology many years ago, and now they've gone on to be competitors. That's good. It's a free world, democratic world, but if you're really looking for the originators and the Rembrandt of the technology and you don't want to go for a copy, you should talk to Theralase.
Yes. Now, what is this right here?
This is our TLC 1000 series. We're introducing this at the show with some new features. So we have the controller system. It's battery operated. It's got 57 protocols in it, room for 250, so you can program it. Again, being battery operated, you can move it around from clinic to clinic. It comes with a multiple probe system. This is a 5 by 905 nanometer system, 4 by 660. Again, optimized for tissue for the three key cellular pathways. So you would use this one for shoulders, for hips, for knees, plantar fasciitis, lateral epicondylitis, motor vehicle accidents, a lot of the conditions that a chiropractor
would it help neuropathy?
Absolutely. We do a lot of work in diabetic neuropathy, a lot of nerve disorders. We do a lot of work in wounds. We do a lot of work in different conditions. A lot of really positive results that we've seen with this technology in the field. We have thousands of these in the field now, and we hope to have many more thousands down the road, especially after this show. The second probe that we have is this probe, which is we call the triple probe. This is used for smaller formats. So you could use this system for around the face if you're working on a sinusitis or a TMJ condition or a trismus, if you're working on a rheumatoid arthritis, along those lines. The third probe that we have is the acupuncture probe, and this has a point locator. So you can actually locate the points. It'll find it, it'll beep, it'll let the practitioner know exactly that they're on top of the point for efficacy. And then you can fire it and activate the acupuncture points. Now the thing that we're introducing at the show is we have a new cart and a boom arm. What we do, and this is an ad that was in Chiropractic Economics, And what it shows, you might recognize it.
Yes.
And what we have is a full cart that you can roll around from room to room. A lot of chiropractors like to treat in multiple rooms in their offices. But what it does have is it has a boom arm. This boom arm can be set up, it's got a little gooseneck at the end, so it can be set up for hands-free use. So the practitioner can set it up, they don't have to hold it, they can go do their soap notes, you know, take another call, get ready for the next patient.
And they're always moving, I know that.
Always moving, always moving. So they want to deliver effective treatments to their patients. They want to do it in a safe manner, but if they can optimize their use of their time, a chiropractor is very busy. If they can optimize the use of their time by putting the technology on it and not having to wait and sit and hold the device, it's just better for their business. So helping patients and generating revenue for their clinic is obviously something which I'm sure is important to chiropractors.
If I have a carpal tunnel syndrome, how do you deal with that?
Well, if you had a carpal tunnel syndrome, I'd have to look at it a little bit and maybe palpate that area. And then what you do is you just take the device here, and we'd have a look at it, and we'd say, oh, you're all ready to go. So we activate that. You put it in direct contact with the wrist, okay, perpendicular, a little bit of pressure, you just hit on. You can see a little bit of the red light coming out.
Yeah.
The 905 near infrared light you're not going to be able to see. The eye can see from 400 to 700 nanometers. 400 we see as violet. 6 to 700 we see as red. So anything above 700 is invisible to the eye. Anything below 400 is invisible to the eye. So 905 would be invisible to your eye. So it's direct contact, a couple of minutes, it would shut off, you would choose a new location, usually about a centimeter and a half away, or about an inch away, treat another location, and then I may work up the extensor muscles, or I may even go back to a cervical process back here, depending on your condition, or if you have a radiculopathy.
Now, if I'm a doctor of chiropractic and I want to interact with you, how might I do that?
What you can do, it's best you can go to our website, www.Theralase.com, Theralase.com. Call us toll-free, 1-866-843-5273. Or you can email me at rwhite, R-W-H-I-T-E, at Theralase.com.
And ask for Rembrandt, right?
And ask for Rembrandt. I'll answer the phone.
Thank you, sir.
Real pleasure. Thank you. Take care.